Okay. Mic check, testing 1 2 3, testing 1 2 3, mic check. Mic check, testing 1 2 3, testing 1 2 3, mic check, testing 1 2 3, testing 1 2 3, mic check, testing 1 2 3.
Is it coming through?
Yeah, it still is. Does it deliver that?
But you're able to hear.
It's just going through its place to go to lowest points.
Good afternoon, everyone, and welcome to the COVID-19 update for Monday, November the 2nd. I'm joined today by our Department of Commerce and Economic Opportunity Director, Aaron Guthrie, to talk about the financial support that we're offering to businesses and communities throughout the state as we battle the economic impact of this public health crisis. I'm also pleased to be joined by Tanya Hernandez, owner of Nobias Davila, and Raul Raimundo, representing the Resurrection Project. Today is the first day that resurgence mitigations take effect in Region 6, East Central Illinois, and yesterday IDPH announced that Region 2, now up to a rolling positivity average of 9.7%, will enter Tier 1 of our resurgence mitigations to bring down levels of COVID-19 community transmission enough to once again safely expand indoor capacity for taverns and restaurants and return more kids to school. It's my hope that these temporary Tier 1 mitigation measures will work as they did for Regions 4 and 7 in September and October to lower the number of cases and the positivity rate as soon as possible. The virus is spreading, and every region of the state is suffering from its insidious, invisible contagion. For perspective, this is one of the worst single-week increases in regional positivity across the state since the spring. The lowest increase in any region was 1.2%. That's in Region 5, Southern Illinois. The highest was a 3.1% increase. That's in Region 7, Will and Kankakee counties. Not a single region saw a decrease in the last week. Nothing we can do will immediately reduce the positivity rates or hospitalizations, but our resurgence mitigations are designed to have an impact over several weeks, as long as everyone takes some responsibility for masking, social distancing, and following the CDC and IDPH guidelines. Just like driving a car, when someone blows through a stoplight, they not only risk their own life, but also the lives of all the drivers around them. Right now, the stoplight is red. Please act accordingly. Until we can reduce the upward movement of hospitalizations and bring the rate of spread down, we must keep our economy moving forward and support our small businesses. And I encourage everyone listening to support your local small businesses. These are the heroes who are the lifeblood of our communities, and they're our job creators. Instead of going to a big box store to buy everything, try your local retailer and order lunch and dinner and even a beverage from your local restaurant or tavern. It's how we all can keep each other going. I want to make sure that everyone knows about the actions that I've taken in state government to mitigate the financial impact of the virus on our communities. With the resources that we can afford in Illinois, we're continuing to dedicate substantial support for our state's residents, their families, small businesses, nonprofit organizations, and local governments to help them get through this pandemic. For business owners and communities, I've directed the Department of Commerce and Economic Opportunity alone to deploy $1 billion in economic relief. So what does that look like? Well, in addition to direct community assistance programs, we've offered $270 million for child care providers, $270 million additional dollars in the business interruption grants, $20 million in downstate small business stabilization grants. That's on top of the downstate support coming from the BIG grants, and $14 million in emergency hospitality industry support from last spring. So far, the majority of our 102 counties have received CARES Act funding, with 89 counties receiving business interruption grants and 76 receiving our local government CURE funding. Months ago, in partnership with the General Assembly, my administration focused our federal CARES Act dollars on areas of the economy and necessary human services to reduce the pain that COVID-19 is inflicting. The dollars provided by the federal government aren't nearly enough, so I've simultaneously called for the federal government to deliver more direct assistance for Americans in every state, and I would encourage elected officials across the state to join in on that advocacy. First, for businesses. The COVID-19 economy has been cruel to our workers and our entrepreneurs and their families in every state, yes, even those that have recklessly chosen not to implement any public health restrictions. Every state has experienced devastating job losses, business closures, and financial hardship. No state has been immune to the virus's economic toll. Here in Illinois, we developed the largest business support program in the nation, a combined $636 million grant program for businesses to cover payroll, rent, utilities, PPE, and other operational costs to keep things moving. Over the summer, we sent out our first round of the business interruption grants to industries hit the hardest by COVID-19, $49 million to more than 2,800 businesses in over 400 Illinois cities and towns across 78 of our 102 counties, more than half of which went to minority business owners. And it's not just business that shouldered new pain in this pandemic. Local governments, too, have taken on new costs in this crisis, from the buying of PPE to supporting overtime pay for essential workers. The $250 million local CURE program is designed to support the more than 1,300 municipalities, counties, fire departments, public health departments, and all local governments in downstate Illinois. Cook and Collier counties received direct allocations from the federal government. That's what we've done so far, and there's more to come. There is a combined $350 million remaining between the BIG, Business Interruption Grant Program, and the local CURE program available right now for local governments and for small businesses. There's $175 million available now for small businesses affected by the pandemic. Applications are open for small businesses of every industry. And we also have specific funding set aside for businesses in disproportionately impacted areas. For more on how to apply, visit dceo.illinois.gov. Applications will be accepted on a rolling basis until the funds are exhausted. In offering this support, we've made it a priority to help the type of businesses that have been left vulnerable by COVID-19. This includes helping industry sectors impacted most by our mitigations: restaurants, taverns, movie theaters, performing arts venues, and other event spaces. We've also provided dedicated programs for downstate small businesses as part of the big grant program. We're paying special attention to minority-owned businesses, which, let's be honest, have faced underlying obstacles even prior to the pandemic that have made this crisis all the more damaging. To date, nearly half of our awards have gone to minority-owned businesses. 39% have gone to women-owned businesses, and 49% have gone to disproportionately impacted areas. And Director Guthrie will explain more about what that means in just a moment. If you're wondering what types of businesses have received these grants so far, here are some of them. $46.5 million for 1,898 restaurants and taverns. $9 million for 416 gyms and fitness centers. $3.3 million for 64 indoor recreation venues. $3.0 million for 51 event spaces. $1.9 million for 46 concert and performing arts venues. And as a reminder, nearly twice as many dollars are still available compared to what's already gone out. So the number of recipients will increase substantially as more businesses apply. And I want to make sure we help everybody that we can and everywhere we can. All of that is under our BIG, Business Interruption Grant Program. So let me take a moment to talk about our $250 million Local Government Cure program. Local Cure is the fund that supports local governments by reimbursing them for expenditures incurred during the public health emergency, such as overtime payroll for first responders or local human services, PPE, plexiglass dividers, and much more. To date, nearly $50 million in funds have gone out to over 206 local government units, with another $31.9 million in process. Again, Cook and the Collar counties received direct supports from the federal government, so these dollars are for towns and other government entities across downstate Illinois. But while over 390 payments have gone out, local government units statewide are eligible, more of them are, but more than 500 of those have not yet registered to receive their funds. This is an urgent call to action to local mayors and city councils outside of Cook and the Collar counties. Submit your costs soon to make sure that your community is getting the local cure dollars that you deserve. Reimbursements get turned around in as little as 1 week. You can contact DCEO to register for these funds, and if you're a resident, call on your local leaders to make sure that this gets done for your community. Our DCEO team has been working around the clock to make sure that nobody is left behind in accessing these programs. That ranges from direct outreach and webinar programs to help everyone fill out the necessary forms properly, to helping businesses that have yet to receive their PPE or were never able to access federal assistance before it ran out. So with that, I'd like to turn it over to our Director of the Department of Commerce for more comments about the BIG program, Local Cures, and other that we're doing all across the state to help businesses and local governments. The Director is Aaron Guthrie. There you go.
Thank you, Governor. Good afternoon, everyone. I'm Erin Guthrie, Director of the Department of Commerce and Economic Opportunity, or DCEO. I'm here today to give an update on the distribution of the critical relief programs we've launched to provide economic support for our communities across our state. Since I last joined the Governor just a few days ago, we've continued to make good progress on ensuring funds are available through the business interruption grants and the local cure programs. We're reaching people in need and reaching them quickly. But what's most important, as the Governor indicated, is the remaining dollars and how we are working to connect those with the communities and businesses facing the most profound economic damages from the virus. At DCEO, we've developed a plan for outreach that covers our entire state and engages those eligible for big and local cure with the tools they need to apply. To ensure no one is left behind in these economic support programs, our DCEO team has led an aggressive strategy to deploy our team members and partner agencies to get the word out. For local governments eligible for the local cure reimbursement, we've partnered closely alongside cities, towns to help them recoup the maximum amount of reimbursement under their CRF eligibility. This outreach has spanned thousands of calls, dozens of webinars, and the launch of a user-friendly website providing detailed information about eligible costs. And for governments in need of more help, namely smaller towns with fewer staff, we stood up dedicated office hours to provide step-by-step instruction on submitting eligible costs over the phone with our team of experts. There's more to come on this. For BIG, we've built on the work we've done to reach small businesses, our core customers, since March. We've developed several grant programs since the time this crisis first hit, and we quickly hit the road to reach out to businesses, chambers, and economic development organizations representing every facet of our state with information on how they could access our programs and even PPP. As the governor mentioned, we've touched 10,000 small businesses through these efforts, with 60 webinars for BIG alone. Part of this has been made doable through the creation of the Disproportionately Impacted Areas, or DIA designations, identified by the General Assembly and the governor to help places in distress. These hard-hit geographies have received a third of the total funds. A map of the 176 DIAs can be found online on our website. But to make sure grant funding is deployed equitably to our Black and Brown communities, we've enlisted the support of 4 community navigators, organizations who specialize in reaching hard-to-reach communities with tailored support that will not only help them to apply, but qualify for needed funds. These organizations include the Chicago Urban League, the Illinois Business Immigration Coalition, the Greater Auburn Gresham Development Corporation, and the Resurrection Project, joining us here today. As a result, nearly half of all of our big funds have reached our hard-hit minority communities, which, let's face it, have dealt with hard economic challenges, even prior to this pandemic. That includes businesses like Tanya Hernandez, who's based in the vibrant Little Village community. Novias de Vida is known for its specialty quinceañera and wedding dresses. When COVID-19 forced many to cancel wedding and family parties ahead of the busy summer season, Tanya faced many canceled orders. Though faced with a financial nightmare, she put her own challenges aside and put the safety of community first. She and her team pivoted to make masks for her community, with over 1,000 made to date for area schools and community centers. A recent BIG award will allow her to keep up the work they're doing with their newly adopted business model and to help make ends meet until they start seeing dress orders come back. Her story is just one of the reasons we're working tirelessly to get the word out to our Illinois communities about these critical funding opportunities, because it can help save small businesses, the pillars of our communities. If you or anyone you know is in need of small business support, or if you reside in a community eligible for local cure, we strongly encourage you to contact our DCEO office. We've published data on our website about who has benefited from both of these programs. As the governor said, hundreds of governments haven't yet registered, so please check the list of eligible communities on our website to see if your local government has. And if they haven't, make your voice loud and clear. The sooner, the better. All the information can be found on our website, dceo.illinois.gov. Thank you so much for having me today, and now I will turn it over to Dr. Ngaze Ezike from Public Health. Thank you.
Hello and good afternoon. Over the weekend, as you've heard, we announced Illinois' highest one-day totals for COVID-19, both for confirmed cases and for testing. I've seen and heard about lines of cars and people at testing sites all across the state. I'd like to thank all those responsible Illinoisans that are taking advantage of all the available testing and ensuring that they know their status for that day. By going to get a COVID-19 test, you're not only taking care of your health, but the health of your family and your community's health as well. In the past 24 hours, 68,118 tests were reported for a total of 7.8 million tests completed in Illinois. Overnight, 3,371 individuals were reported in the hospital with COVID-19, and of those, 722 were in the ICU and 298 patients were on ventilators. Today, we are reporting 6,222 new cases of COVID-19 here in the state, and we're reporting 20 additional lives lost. To date, a total of 423,502 confirmed cases have been reported throughout the state, and 9,810 total deaths. November 2nd marks the end of the Mexican holiday Dia de Muertos, or Day of the Dead, which began yesterday. This day celebrates those loved ones who are no longer with us by honoring their lives and their memories through offerings of food, flowers, and other items that these individuals enjoyed in life. This year, we honor the lives of the over 9,800 Illinoisans that we have lost to COVID-19. It's nothing less than tragic that we have lost so many lives to this deadly virus, and I grieve with everyone that has been affected. And I can add that I'm very sorry for those who've also had to bear the painful messages like they were already very old or they had multiple medical conditions, as if that makes this okay. As the pandemic continues, let's honor those that we have lost by committing to slow the death toll. And we can do that by wearing a mask, by washing our hands, and by watching our distance. Every day counts and is critical in getting Illinois back on track and away from the mitigations that we're under now. With the holidays just weeks away, let's all commit to safe celebrations. Keep them virtual or keep them super small. Follow our guidelines on how to celebrate safely so that we will have future celebrations to enjoy together. And again, as many people will be going out to vote, please make sure you exercise all these same precautions. Please make sure that your mask is securely fitted over both your nose and your mouth. And please make your selections before you get to the polling booth so you can get in and out as quickly as possible. Thank you. And now for comments in Spanish. Buenas tardes. Gracias por acompañarnos hoy. Durante el fin de semana anunciamos los totales más altos de Illinois en un día para casos confirmados y pruebas de COVID-19. He visto e escuchado sobre filas de automóviles y personas en sitios de prueba en todo el estado. Me gustaría agradecer a la gente de Illinois por ser responsables. Hacerse una prueba de COVID-19 no solo estás cuidando su propia salud, sino también la de su familia y la de su comunidad. En las últimas 24 horas, más de 68,000 pruebas fueron hechas para un total de 7.8 millones de pruebas. Desde anoche, 3,371 pruebas personas en Illinois estaban en el hospital con COVID-19. De ellos, 722 pacientes estaban en la unidad de cuidados intensivos y 298 pacientes estaban en ventiladores. Hoy informamos 6,222 nuevos casos de COVID-19, incluidas 20 vidas perdidas. Hasta la fecha se han reportado más de 423,000 casos confirmados aquí en Illinois y más de 9,800 muertes. El 2 de noviembre marca el final de la festividad mexicana Día de Muertos, que comenzó ayer. Este día celebra a la familia y amigos que ya no están con nosotros, honrando sus vidas y su memoria a través de ofrendas de comida, flores y otros artículos que los muertos disfrutaron en vida. Este año celebramos las vidas de los más de 9,800 personas de Illinois que hemos perdido por COVID-19. Es una pena que hayamos perdido tantas vidas a causa de este virus mortal. Lamento con todos los afectados. Mientras la pandemia continúa, honremos a los que hemos perdido con una promesa a usar una máscara, lavar las manos y mantenga su distancia. Estas próximas semanas son críticos para que Illinois vuelva a rumbo derecho y se aleje de las mitigaciones. Con los días festivos en unas semanas, todos tenemos que tener celebraciones seguras y saludables. Háganlos virtuales o háganlos pequeños. Siga nuestras pautas sobre cómo celebrar de manera segura para que podamos celebrar por muchos años adelante. Muchísimas gracias para su apoyo. And with that, I will turn it over to Ms. Tania Hernandez.
Buenas tardes. Primero que nada, quiero agradecer al gobernador por la ayuda a los pequeños negocios como el mío. Mi nombre es Tania Hernández, propietaria de Novias Dávila. Empezamos nuestro negocio en 1998 en Cícero. Después nos movimos a Little Village en el 2012. En nuestro negocio vendemos vestidos para novias y quinceañeras. La pandemia nos ha pegado fuerte. La mayoría de nuestros eventos se movieron para el próximo año. Para mantener nuestros empleados trabajando, empezamos a hacer mascarillas. En total hicimos 17,000 mascarillas que fueron donadas para mantener nuestra comunidad sana. Después empezamos a venderlas para ayudarnos y obtuvimos órdenes de compañías y organizaciones, pero pasó el tiempo desde la última orden. Si alguien necesita mascarillas, por favor, llámenos. Necesitamos de su negocio. El Big Grant que dio el Estado fue esencial para nosotros. Nos ayudó a mantener nuestros empleados y a pagar rentas. Sin esta ayuda financiera, nuestro negocio no podría sobrevivir. El grant ha sido de gran alivio para nosotros. Estamos fuertes y positivos porque la pandemia termine pronto. Gracias al gobernador y por favor siga ayudando a nuestros pequeños negocios. Good afternoon. First, I want to say thank you to the governor for helping small businesses like mine. My name is Tania Hernandez, owner of Novias Dávila. We opened our business in 1998 in Cícero. Then we moved to Little Village in 2012. We are a shop that sells dresses for weddings and quinceañeras. The pandemic hit us hard. Not that many people get married or having quinceañeras. To keep our employees working, we started making masks and donated to help our community stay safe. The big grant that was provided by the state was essential for us. It allowed us to keep our employees and pay rent. Without this financial help, it was impossible for us to survive. We are facing critical times, but the big grant has been a lift for us. We are staying positive and hope this pandemic ends soon. Thank you to the governor. Please continue supporting small businesses. Thank you. Now I'm going to introduce Raul Raimundo.
Gracias, Tania. Thank you, Tania. My name is Raul Raimundo. I'm the co-founder and CEO of the Resurrection Project. I'm here to emphasize a couple of things. But first, as Tania mentioned, I want to thank the governor for making resources available for small businesses. Small businesses are the backbone of our economy. And small businesses in black and brown neighborhoods are not just the backbone, they're the lifeline of many of these local communities and economies. And Director Guthrie for prioritizing these businesses, because these small businesses don't have typically what large businesses do, which is a full-time accountant, a full-time HR person that can assist them in navigating through all sorts of opportunities. But let me emphasize three things. One, this is a grant, not a loan. And this is very important because it is again supporting the businesses that have felt the hardest pain during this pandemic. It is very important that businesses that are out there take advantage. It's also been simplified. The program is such that Director Guthrie and her leadership has created such a simple application process, so there's no reason why small businesses like Tania and others throughout the state of Illinois can access this opportunity. And thirdly is also, as the governor mentioned, I want to echo what he said earlier, support your local businesses. They're not just a lifeline, they're not just a backbone, they are going to be there for tomorrow, employing more individuals. So, Governor, I want to thank you, your administration, for supporting. As Director Guthrie said, there are groups out there, navigators, that are helping businesses to apply for this grant. The Resurrection Project is one of them, Urban Gresham CDC is another, Urban League is another, and of course our colleague organization, the Illinois Business Immigrant Coalition, has been working throughout the state to encourage more small businesses who have felt tremendous pain to apply for this grant. Brevemente en español, mi nombre es Raúl Raimundo, el Proyecto Resurrección. Quiero agradecer al gobernador y a la directora Guthrie por priorizar recursos para nuestros pequeños empresarios que necesitan este apoyo porque han sufrido mucho durante esta pandemia. Los pequeños negocios son críticos en nuestras comunidades y recibiendo, voy a repetir, otorgar no es un préstamo, sino una inversión que no se tiene que pagar a las pequeñas empresas en nuestras comunidades. Muchas de nuestras pequeñas empresas no tienen contadores de tiempo completo o otros recursos para poder aplicar a estos programas. Y es importante que nuestros comercios apliquen a este programa para recibir fondos que no se tienen que pagar. Otra vez, se están otorgando, no se están prestando para nuestras pequeñas empresas. Sabemos que esta pandemia ha afectado a muchos en nuestro estado y también me uno a la doctora Sique en suplicar que hay que utilizar la máscara, hay que prevenirnos para que no ocurran más tragedias en nuestra comunidad. I also want to echo what Dr. Ezekiel said, that we should wear masks, we should be preventative so that no more tragedies can occur in our communities. Governor?
We'll start with questions online and then take questions in the room.
Sorry, before I take questions, I just have a few other comments. I want to take a moment to remind everyone that there are about 28 hours left before the polls close. So if you haven't voted yet, you can still vote early in person today at locations throughout the state, as well as in person tomorrow on Election Day. If you still have your vote by mail ballot, you can do one of two things. Either bring it with you and vote in person today or tomorrow, make sure to bring it with you, or fill it out and bring it directly to your local election authority and check to see if you have a secure ballot drop box in your area. Do not mail your ballot unless you take it directly to the post office and have it postmarked by tomorrow. If you want to vote but still have not officially registered to vote, it's not too late. You can still just show up at your local polling place today or tomorrow and can register and vote in person on Election Day. In all of these cases, if you're going out to vote or just dropping off your vote by mail ballot, don't forget to wear your mask and keep socially distant. Now, we have seen record numbers of early voters, especially voting by mail here in Illinois and across the nation. And that's a great thing for avoiding the crowds on Election Day so that we can tame the virus and make sure that everyone is safe. And it's a great thing for our democracy. But counting votes that arrive by mail is time-consuming work for our county clerks and their staffs. With vote by mail hitting all-time records, that means that we have to be patient about the results of all races this year. It will possibly take until Wednesday or Thursday or even Friday to get results for some races in Illinois and in states across the country. Every vote must be counted, particularly on the national level. It is very important that we are patient with the presidential election. We may very well not know who won the election on Wednesday, let alone Tuesday night. Some states have more staff and high-speed processing of mail ballots, and some don't. I want to put heavy emphasis on this last point. For the next few days, it's extremely important that you not get your election news over social media. We know that there are foreign actors, specifically Russia, Iran, and others, who intend to promote misinformation throughout Election Day and in the days after. They would like nothing more than to promote conspiracy theories and sow discontent. If you want accurate information about the vote count, go to your local election authority's website, or to the Politico website, or to the New York Times website, where they track all the races nationwide, or visit other reputable national news outlets. I urge anyone who wants up-to-the-minute news on the status of the election to go to reliable, trusted sources of information. Look at a variety of news outlets if you like, but be wary of claims you see on social media. Foreign actors posing as Americans are producing disinformation, such as fake videos or fake official statements, hoping that you will repost it. So check before you repost anything, or better yet, you may want to take the next few days off from social media. Facebook and Twitter will still be there in the morning. Thank you, and with that, I'm happy to take any questions. You want to start on
Yep.
mine? Okay.
John O'Connor at the AP. Would you or Dr. Ezike explain why the state is reporting test positivity as well as case positivity, what each tells us, and what is more accurate?
Well, let's be clear that test positivity, which is what we use to decide about mitigations, is the standard that's used by the CDC, the WHO, and really most authorities out there in most other states. So that is a very important one to watch, and of course, we follow that by region in Illinois. Case positivity is another measurement of positivity. It's one that we began with very, very early on. We continue to report that. They track fairly closely. They're about 1 to 1.5% difference between each other, but what's important about them is they move in the same direction. And so when you see case positivity moving, you're seeing test positivity moving and vice versa. So we post both of those numbers. There's a third measure of positivity. Two, we don't post, but that's how we think about positivity.
Dave Dahl, WTAX. Governor, the Lieutenant Governor said not long ago that the flat income tax would have to be raised 20% on everyone if the tax question fails tomorrow. How closely does her statement reflect the administration's intent here?
Well, I think she was just letting everybody know something that I think everybody knew before we even introduced the fair tax, which is that in order to manage our budget properly, in order to make up for the challenge that was left behind when I took office, which is an enormous bill backlog of $8 billion and a structural deficit of $2 to $2.5 billion, we need to do something. Either we've got to cut virtually everything in state government by about 15%. That means education and public safety and so many other human services that people rely upon, or to find revenue. And, so I think the Lieutenant Governor was simply reflecting that fact.
Jim Haggerty at the Rockford Advocate. Region 1 is now seeing a positivity rate of more than 14%. At what point will there be more restrictions in this region, and what could those look like?
Sorry, I just want to complete something I was saying in the last question, and that's that, as I said at the, as in the beginning of the discussion about fair tax, that there really are, those were two choices that we were faced with, and I proposed a third way, and that's what the fair tax is all about, and it's really about lowering taxes on the middle class and those who are striving to get there, and asking the wealthiest people in the state to pay a little bit more. Would new mitigations be imposed on a region that continues to go higher? Of course, we have to consider Tier 3 mitigations. If you look on the website for resurgence mitigations, there are other things that we can do. But I also want to remind everybody that it takes a couple to 3 weeks to see a set of mitigations start to have an effect on positivity in cases and so on. And so it's not something that you just impose one after another after another. Tier 1 mitigations, you want to see after 2 or 3 weeks how they're affecting the numbers. Again, Tier 2, which we put in place for Region 1, 2 to 3 weeks more to try to see if we can bring that 14% down. And we'll be watching it very closely. I do every day.
Sarah Mansur is asking, can the governor clarify whether violations of the in-person dining ban at restaurants and bars could result in a misdemeanor fine under the non-compliance with COVID-19 regulations rule from IDPH?
It's a rule that was passed by JCAR, an emergency rule put in place this summer. So yes, of course, there's a rule in place, and we've been, in fact, or state police and others have issued warnings, dispersal orders, and fines.
Hold on one second. Kate at Channel 7 is asking, we were wondering if the governor could speak to the presence of National Guard members heading to McCormick Place. In addition, if and how the state may be addressing concerns of post-election safety and the possibility of protests.
Sure. So we're, out of an abundance of caution, we've made sure that our National Guard is simply in a state of readiness. We did this back during the, the few days before the ruling around Breonna Taylor. We want to make sure that cities, counties that call upon us for help from the state of Illinois, that we have those resources available to them. We, of course, have our terrific Illinois State Police, and then, best in the nation as they are, so too is our National Guard, and so we simply have them at a state of readiness in case they are asked to help.
Shia at Politico, can you please address your concerns about how COVID's economic impact might be affecting how voters think about the ballot measure for the graduated income tax?
Well, it certainly has not made our budget situation any better. COVID, in fact, if you look at the budget that I pushed and got passed in the General Assembly for fiscal year 20 was in fact yielding a budget surplus all the way through March of this year. And so we're very proud of that, hoping that we could use the surplus that we might generate to pay down bills that have been racked up in years prior to my becoming governor. Unfortunately, COVID-19 hit us. It has done terrible things to our budget. It's basically taken away a lot of revenue from the state and caused us to have to incur not insignificant expenses. Although the federal government has helped with some of the expenses, but not with replacement of revenues yet. And so COVID has had a devastating impact, there's no doubt about it. And this is exactly, in the middle of an emergency, is exactly a moment when you want your state government to have resources in order to provide human services for people and first responders, and making sure that our healthcare system is strong. So it's we're working very, very hard to make sure that we have those resources, and as a result, I'm hopeful that we can impose a fairer tax system in the state of Illinois, and it will have the resources to help us out.
Jim Leach at WMAY, can you offer any additional detail on the data that led you to close indoor bars and restaurant service, specifically the difference between outbreaks in those locations and potential exposure at those establishments?
Why did we choose bars and restaurants as one area that we're mitigating? One area of mitigation. Well, let me just be clear. If you look at our Tier 1 mitigations, there are quite a number of them that went into effect, including significantly reducing gathering sizes. We want to make sure that people know that wearing a mask, that when you're gathering with people, that it can't be in a group of more than 25 or 25% of the size of a venue. Bars and restaurants, as I've said over and over again, show themselves in not only all of the studies around the nation, around the world, to be locations that amplify the spread of COVID-19, but also show up in our exposure data. When you ask people in contact tracing, where were you over the prior number of days, and almost everybody says, many people anyway, say that they were at a bar or restaurant during that period. And so, when you have, it doesn't necessarily mean there was an outbreak in a bar or restaurant, but it does mean that it's an exposure location, and we all know from the studies that in those locations where people are not wearing masks, typically they're hanging out for an hour or so unmasked. That is a danger to people, and so we've had to limit temporarily indoor service at bars and restaurants. We're hoping to get back to a point where we can open up indoor service as soon as we can get our positivity rates and our case numbers down.
Does the state have current estimates on the impact of the recent mitigation measures statewide on Illinois' economy, unemployment, and then eventually the state government's revenue and budget?
We certainly can see the impact the virus has had on Illinois. So, that's the data that we're following, is what impact do we have. Remember that even states that didn't open up I mean, that were completely open and never put in a stay-at-home order or never did anything really in terms of mitigations, are suffering mightily from the economic plight brought on by COVID-19. So this is happening all over the country. I mean, Florida, Texas, Iowa, Wisconsin, it's devastating for everyone.
Ben Cox is asking, several municipalities are pushing back against your mitigation, saying they don't have enough manpower to enforce a shutdown. Region 3 mayors Jim Langfelder, Kyle Moore, and Andy Ezzard have all said this. What's your response?
Well, first of all, there's the word shutdown is used in that question. All we're asking is for simple enforcement. Many restaurants and bars are doing the right thing. They're either tenting using outdoor tents, or they're just providing pickup and delivery service or drive-through during this difficult period. And what we're asking is that the enforcement be brought where people are not following the closure of indoor bars and restaurants. And I do believe that law enforcement locally, the health departments locally, mayors should do the right thing. And some are choosing not to. And I would encourage people to speak to their local leaders and remind them that leadership means making some difficult decisions.
Kelly Bauer at Block Club, what metrics would we need to trip to trigger another stay-at-home order regionally or statewide?
Well, at the moment, as I've said, if you have a sustained upward trajectory of positivity in your region, of hospitalizations in the region, of cases in a region, even after a Tier 1 mitigation measures have been put in place, we have to look at Tier 2 and Tier 3. That's the question. When would we impose additional mitigations?
They're looking for a number in relation to a stay-at-home order.
Oh, we're not currently looking at a stay-at-home order. I mean, obviously, that's something that lurks in the background. If we believe that these tiered mitigations ultimately are ineffective, if people choose not to wear masks, and if the spread of the virus continues to go unabated in a kind of community spread, we would obviously have to consider more significant mitigations.
Jamie Monks at the Tribune. In the spring, the administration said that 30 contact tracers were needed for every 100,000 people. Is that a large enough number of contact tracers to be effective given the current level of spread in Illinois, or are more needed, and if so, how many more?
So it's hard to tell exactly. I will say that we're near the goal that we originally set, and we definitely have more cases than we did when we originally set that goal. So there's no doubt that we're going to look at continuing to grow our contact tracing. I should remind everybody that the federal government has a testing and tracing bill before it, the Congress does, and it hasn't acted upon that. We need additional help in order to continue to grow our contact tracing in any significant way. But we've actually built a reasonably good infrastructure for contact tracing. It's still filling in. There are parts of it that, there are counties that need more hiring to be done, and we rely upon the county local public health departments to do that. But we're in a decent position now. We definitely should hire more if we continue to have this increasing caseload.
A.D. Quigg is asking about hospitalizations, and as they're ticking up across the state, could you talk about whether you're seeing competition from other states again for PPE and other equipment, or is our stockpile sufficient statewide to meet the current demand for some time?
It's hard to say if you're sufficient in stockpiling your PPE. I mean, but I will say I think my team did a yeoman job in the middle of the worst part of the pandemic. Back in the spring, we were madly, as you may have heard, trying to acquire PPE. We didn't stop when things subsided. We continued to amass a stockpile because we were concerned, frankly. I think everybody was concerned about a second wave in the fall. And so we have a significant amount of PPE now. It's sufficient for now, but we'll continue to acquire PPE as we need it.
All right, we'll do a couple in the room, and then we've got to go.
Yep. Hi.
So a pretty reliable source told us that the plan is to move the whole state back to phase 3 after the election, meaning, no gyms, no churches. Is that true?
That's not a plan, no.
That is not a plan.
I mean, obviously, that's an option, I guess, but whatever you heard is not accurate. I have not had any discussions about that.
IDPH provided guidelines to school districts and then allowed them to make their own decisions on whether to open in person or remotely. Did you consider doing the same thing for counties and cities? Why or why not?
Well, as you saw, what we did was we created regions. Instead of just counties and cities, we created regions, we're trying to make decisions based upon the numbers for each region. I know that we've been asked by cities or counties to have them make their own decision about what they would like to do, or to be broken out into a separate region and have decisions made separately for them. Some counties or cities feel like they're doing better than some neighboring county or city. But the reality is, as you know, people travel from one area to another, from one county to another, from one city to another. And so we do need to apply these mitigations across broader swaths of territory than a city or county.
But that seems different than what you're doing with school districts. You're saying school districts are different, right? And they can make their own decisions, but counties can't and cities can't.
Well, but let's be clear, let's talk about the individual schools and individual school districts. They're all quite different. And I'm sure one city would say that they're different than another, but the populations, generally speaking, are not that different from one county to another. What I will say is that schools are kind of an unusual thing. We've got 4,200 or so schools around the state. We have 850 or so school districts. And we believe that because parents will be involved, because local school boards will be involved, because teachers will be involved and superintendents will be involved, that they're going to be thinking all the time about the best interests of those children in particular, but also the broader community, the effect of that school on a broader community. But the shapes and sizes of these schools, the mitigations that could be put in place in one school are different than could be put in place in another. The decision about whether to go remote or hybrid or all in person are dependent upon the capability of that local school, the shape and resources available. So that's why we let local school districts make those decisions.
We'll take one more question.
Did you not have the same faith in the counties to do that, though?
Well, we have a lot of faith in the counties, but remember, the resources for making decisions, at least broadly for the state, we have at the Illinois Department of Public Health. That's why we put out a very, very, very extensive set of guidance for the individual schools out there. All the schools have been given this guidance, to live within that guidance, but it gives them, some ability to maneuver. Here's what we did with cities and counties. We set a minimum parameter for everybody in these counties, in these regions rather. And then you've heard me say it from here, we want cities and counties to make decisions for themselves about whether they should have tighter mitigations, because it is true that some areas, we've talked about Region 1, for example, where the positivity level is higher than any other in the state. We want local governments there to say, hey, we've got a problem that's different than another region, let's up the game here. But as you can see, every region is going the wrong direction. We have got to make sure that everybody's following the rules here. And I know that some people don't like to hear me say it every time I stand up here. I'm going to say it. I get ridiculed by one particular person in the room sometimes. I will just say that please, 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 to everybody, wear a mask and keep socially distant. If we did that, I promise you we can bring these positivity rates down all across the state, and particularly in the rural areas, which are being most terribly affected right now.
Thanks.
Can I just ask one more question? It's about the American flag. It's about the American flag, because there's met a World War II vet, and he's also a Korean War vet. He wants to know why the flag is still at half-staff. I know you put it down and ordered all the municipalities to put it to half-staff in March. It's been 8 months now. Yeah. When can we see it at full staff?
We've lost,
because it's election day.
We've lost more than 3 9/11s in 9 months. More than 3 9/11s. More than 9,700 people have passed away. We are losing dozens of people every single day. So yes, I think during this pandemic, until we get through this pandemic, I think it's the right thing to do to recognize the terrible loss that so many people who can't even go to a funeral sometimes for a relative or a friend, this is one way that we can honor all of them.
All right, thank you, everyone.